Pediatrics for 6th semester students of the Faculty of Medicine. Pediatrics in Semester 6 is a course that focuses on the care and management of children's health. From newborns to adolescents. The primary focus of this course is to recognize and address health problems in children while understanding their physical, mental, and social development. Below is a detailed and structured explanation of pediatrics in Semester 6-1. Introduction to Pediatrics. Definition. Pediatrics is a branch of medicine that studies the health conditions of children, including growth and development, physical examination, diagnosis, treatment, and disease prevention. Objective: to provide an understanding of the factors affecting children's health and how to manage emerging health problems. 2. Growth and development of children. Growth, increase in body size, including height and weight. Growth measurements using WHO or CDC growth charts. Development, physical development, growth of organs and bodily functions. Motor development, mastery of gross motor skills, walking, running, and fine motor skills, writing, drawing. Cognitive development, ability to think and learn, from object recognition to abstract thinking. Language development, developing speaking and communication skills over time. 3. Child health examination, physical examination, weight and height measurement, assessing nutritional status and growth. Head examination, identifying conditions like head enlargement or abnormal head shape. Heart and lung examination, checking for heart abnormalities or respiratory issues. Abdominal and internal organ examination, detecting organ enlargement or digestive issues. Neurological examination, assessing the central nervous system's development, including motor coordination and reflexes. Developmental screening, evaluating the development of gross and fine motor skills, language, and social skills. 4. Immunization in children. Essential vaccines, basic immunizations, vaccines given to infants and toddlers, such as BCG, polio, hepatitis B, DTP, Hib, and measles. Additional immunizations. Vaccines like HPV for preventing cervical cancer and influenza vaccines. Immunization schedule. Vaccines given according to the child's age to prevent dangerous infectious diseases. Benefits of immunization. Preventing the spread of infectious diseases. Protecting children from conditions that could lead to disability or death. 5. Common childhood diseases. Respiratory infections. Upper respiratory infections, common cold, sore throat, and flu. Lower respiratory infections, such as bronchitis and pneumonia. Diarrhea, caused by bacterial or viral infections, often related to poor sanitation. Malnutrition, poor nutrition affecting growth and development. Allergies and asthma. Allergies to food, medications, or environmental factors that trigger asthma symptoms. Contagious diseases, measles, rubella, and diphtheria, which can be prevented through vaccination. 6. Chronic diseases in children. Asthma. A chronic respiratory disease that causes breathing difficulty due to inflammation of the airways. Type 1 diabetes. An autoimmune disease that leads to an inability to produce insulin. Congenital heart disease. Heart defects present at birth, which can affect heart function and blood circulation. Obesity. Excessive body weight that can lead to health issues like type 2 diabetes and cardiovascular diseases. 7. Neonatal diseases, newborn, prematurity. Babies born before 37 weeks gestation. With increased risk for respiratory problems, infections, and feeding difficulties. Organ development disorders. Incomplete organ formation leading to birth defects. Neonatal jaundice. Yellowing of the skin in newborns, usually due to elevated bilirubin levels in the blood. Neonatal sepsis. Life-threatening infections that can occur in newborns if not treated promptly. 8. Mental health in children. Behavioral disorders, ADHD, attention deficit hyperactivity disorder, and other behavioral disorders affecting children. Emotional disorders, stress, anxiety, or depression in children, impacting social relationships and mental development. Autism spectrum disorder, a developmental disorder that affects speech and social interaction skills. Mental health counseling, identifying and addressing children's mental health issues while providing emotional support. 9. Pediatric emergencies, seizures in children. Febrile seizures or other types of seizures that require immediate intervention. Respiratory and cardiac arrest. Managing infants or children who experience respiratory failure or cardiac arrest. Trauma. Managing injuries caused by accidents, including physical and emotional trauma.